The combat lifesaver is a non-medical personnel who is trained in the 3 phases of TC3. So they'll have a better chance of survival if the combat lifesaver can get to them and quickly assess the life-threatening injuries, as well as treat them. TC3 is short for Tactical Combat Casualty Care. And the 3 phases are Care Under Fire, Tactical Field Care, and Tactical Evacuation Care phase, and are thus explained. During Care Under Fire, your soldier will return fire and seek cover and try to get to that casualty once that casualty goes down. If that casualty can come to you, that is your best bet to try to get that casualty to come to you. If that casualty cannot come to you, you want to suppress fire and move to the casualty as needed. Once you get to that casualty, you will assess the casualty's injuries. If there are life-threatening injuries, you want to try to treat on the spot, especially if there is evidence of severe hemorrhaging. You want to stop that bleeding because that can lead to further injury or even death. The most important thing you don't want to do is put yourself in harm's way. Okay? So remember, return fire, but seek cover and don't put yourself in harm's way. The second phase of TC3 is your tactical field care. During your tactical field care, you're most likely not under enemy fire anymore. But if you are, you still want to maintain as if you were in the care under fire phase. At any time, it can go from tactical field care back to care under fire, and then you have to move. But during your tactical field care, this is the phase where you assess your ABCs, airway, breathing, and circulation. Okay? You want to make sure your patient has an airway. There's all types of medical treatment you can do and give, and interventions you can do and give to patients that's having trouble breathing, okay, or who does not have an airway. The one thing you don't want to do in the tactical field care phase is CPR. CPR takes too long to do, and if you're in the middle of the battlefield, you don't want to get caught up doing CPR. What you can do is find out what is causing the patient to have trouble breathing, whether it be tension pneumothorax or, there may be some jugular vein distension. He may just be having trouble breathing. He maybe has a lot of anxiety. Okay, so remember those ABCs. You also, if you want, you can go ahead and assess for fluid resuscitation. If you want to give IV at this time, you can give an IV at this time if you have the time. During your third phase of TC3, which is your tactical evacuation care phase, this phase is where you want to reassess all of your interventions that were done prior to that phase. Whether you put on a tourniquet, whether you did a needle decompression, whether you did IVs, whether you got some sort of airway adjunct into the patient. You want to make sure that these interventions are still working and that they're still in place. Also during this phase, at that time, you would go ahead and start to package your patient for movement. You never know when they're going to come. Sometimes they say they're coming, sometimes they're not. Things happen in battle. Make sure that you have all the special equipment that you need, all the special equipment that's there that is going to have to help the patient survive that trip to wherever he has to go to that next higher echelon. I have given you a short brief on TC3, Tactical Combat Casualty Care. First phase is care under fire, return fire, seek cover, grab your patient, treat injuries. Second phase is tactical field care, assess your airway, breathing, and circulation, provide interventions if need be for further injuries. Tactical evacuation care phase, make sure your patient is packaged up and ready to go when that bird lands. This has been Tactical Combat Casualty Care brief of the jobs of Combat Lifesaver. My name is Douglas Jones. Thank you.